most of the public do not really know what is a urology as a department, what do they do, what kind of symptoms do they treat, and what kind of medical conditions they can handle. There is this myth, feminine hygiene affects the urinary tract infection. So how true it is? What is the fundamental difference in the urinary tracts between men and women?
Basically, the difference in the urinary tract of a male and a female is
There is something called as a prolapse. I think it is called as a pelvic organ prolapse. What is this? So when we talk about male infertility, when is that they need to look for a specialist?
and as a urologist are related.
What are some cases? What are some symptoms that they can identify which they can consult with you online? So when they see a blood in the urine, what does that signify? So why do some people feel pain when they urinate? How are these kidney stones formed? Why is the treatment protocol different to different people? What are some common urinary cancers that we can see in India? Blood in urine, testicles being painful, as well as few other reproductive related issues, along with stones in the urinary bladder, are all one of the major health conditions which we have been seeing in the off late. Can we continue to take protein supplements? If yes, how much is more? How far it is helpful to me? Why is my blood in the urine? What is the color of the urine, which is genuine or which it is supposed to be? These are all some common questions which most of us have. And let's uncover in this episode right answers from the right person with regards to this urology or urinary related questions. Welcome to Medicas. My name is Varun. I hope you're all doing well. I welcome Dr. Anuj Arora. He is a urologist from Delhi. He is also a uro-oncologist, a kidney transplantation specialist, and also a robotic urologist. Thank you so much, Anuj, for accepting our invite and joining us today. I'm sure, being a very busy urologist, your time is very valuable. Finally, you made it. And this episode we are going to make today, Anuj, is especially for the awareness as well as some important information which public may be having some skepticism and may be unable to relate to their real life style. So let's actually get into the subject and discuss this points, Anuj. Once again, thank you so much for accepting our invite.
Thank you. Thank you so much for having me.
Dr. Anuj, there is a lot of deficiency that we see around. We are deficient with vitamin D, B12 deficiency, we have omega deficiency. There are a lot of supplements that we have around that I see a lot of people take at various ages based on either a doctor's prescription or from a fitness expert's a prescription and etc. One of the common supplements that of late we see a lot of people are taking is a protein supplement. There is an argument that protein supplements are safe. There is other side of an argument that protein supplements are unsafe. They actually give a lot of heavy weightage on the kidneys, where kidneys really need to work really hard to filter them out of our body. What are your thoughts on that, sir?
See, the recommended dose of protein in a diet of a Indian male or a female is about 1.5 to 2 grams per kilogram of the body weight. And basically, the problem with the over-the-counter proteins is that they are not a very pure source of protein. It has a lot of contaminants and chemicals which can be harmful for the kidneys and the body. And I think if a person is taking a good balanced diet and is taking the plant or an animal source of protein, that is more than enough.
Okay, okay. What is your suggestion for those fitness enthusiasts, those muscle builders, or those sports people? Their diet may not be having the amount of protein that you have suggested, or maybe they require a little more protein than what an ideal person is required because of the amount of workouts that they do on a daily basis. What is your suggestion to them, sir?
See, if a person's kidney function test is normal, the creatinine levels are normal within normal range, and there is no protein excretion in the urine, and the liver function tests are all normal, then on the advice of a specialist dietitian or a nutritionist, persons can take their estimated amount of protein according to their schedule of work or their bodybuilding thing, as you told, or their like sports activity. But it has to be under a guidance of a strict dietitian or a nutritionist, and
Okay.
provided all the blood parameters like kidney function and liver function are normal.
Okay, okay. You made one statement, proteins getting excreted through urine. How can one identify whether their urine has proteins going out of their body or not? Is there an identification mark?
It's a very common test which we do. It's a urine routine and microscopy test, which is just a 5 minutes test we can get in
Okay.
any lab across the city, and it will just show if you're excreting protein in your urine. Then we have some dipstick test also, in which there are some strips if we put in the urine and they change their color depending upon the amount of the protein excreted. This is another way,
Okay,
but
okay.
the most
Other than
reliable will be a urine routine and microscopy.
okay. Other than these two tests, a common man, when I mean, of course, everyone goes to the urination every day. Can they not, naturally identify whether proteins are going out of their body or no?
So that is a very vague method. Some people say
Okay.
that they find their urine to be frothy. They think that the protein is getting excreted in the urine, but that's not a reliable indicator, because
Okay.
frothy urine can be due to other causes also.
Hmm.
So
Okay.
the
Okay.
most reliable indicator is a routine microscopic examination of urine.
Okay, okay. Thank you for that. And yes, I mean, you did already answer, but if there comes a situation where that person needs to take a supplement of a protein in the manner of a powder, let's say, in the market, most common protein supplements are whey protein or plant-based protein. So we know that whey protein comes from milk. Plant-based protein is manufactured from plants. There is a contamination that can happen in both the levels. But if you have to recommend the best of the available, what is your opinion, doctor?
Probably this is not my domain to answer this question, and but from my knowledge, I would say the plant-based proteins would be better. I think
Okay.
a specialist nutritionist or a dietitian should probably take this question.
Right, right. Thank you. I mean, I we can understand that. Doc, now moving on to the urinary tract, because that's what the urology is all about, if I can
Yeah.
understand it correctly. However, most of the public do not really know what is a urology as a department, what do they do, what kind of symptoms do they treat, and what kind of medical conditions they can handle. So, for the sake of our audience, Dr. Anuj, could you explain us what is this urology department? How are they helping the customers, or rather, the patients or the humankind?
Yeah. So urologists are basically doctors who deal with the urinary system, which include kidneys, ureters, bladder, prostate in males, especially testicles, and the reproductive system of the males. We basically deal with diseases of the kidney, like kidney stones, kidney infections. Then surgically, we do kidney transplantation surgeries. Then we deal with stones of the ureter, the bladder. Then we deal with the an enlargement of the prostate, which is a disease of the old age, usually seen in age more than 55 to 60 years of age. Then
Mhm.
we deal with problems related to urination, which may happen in the females also, like increased frequency of urination, increased frequency of urination in the night, urgency, and all those things. So this basically our domain of work related to kidney stones, prostate, and the urination part.
Okay, okay. One quick clarification. Do we also have urologists who are female urologists too? Because I think this is a common subject which is not with respect to only one gender. So we have urinary tracts both in men and women. So, and some of the customers or some of the patients would like to actually prefer gender-based doctors when it comes to their urology or urinary tracts and all. So do we also have urologists who are female doctors? So is that a
Yes.
stigma, or do people don't really care? I don't know. I'm asking my personal question also.
Uh, See, as a urologist, we deal with the urinary tract problems of both males and females. But yeah, we have female doctors who take up urology as their careers. But obviously,
Okay.
it is a little uncommon
Okay.
as compared to male urologists. But as a
Okay.
urologist, we deal with urinary tract problems of both the male and females.
Okay. Okay. Thanks for that. Now, when we talk about these urinary tracts between men and women, doctor, what is the fundamental difference in the urinary tracts between men and women?
So basically, the difference in the urinary tract of a male and a female is in the length of the urethra, which is
Mhm.
the tube which carries the urine from the bladder to the outside. So in females, we have a very short urethra and a straight urethra, which is about only 4 to 5 centimeter in length. Whereas in men, we have a long urethra, which is about 15 centimeter, and it's a curved urethra. And then we have prostate, which is in men only at the junction of the bladder and the urethra, which plays a very important role in like urination problems, which happen basically occur due to the prostatic enlargement. But that is also an age-related problem, which happens usually after the age of 50 to 60. Otherwise, kidneys, ureter, bladder, they are all the same in both males and females. But after the bladder, the tube, which is called urethra, that makes the difference in male
Okay.
and female.
Okay. Okay, okay, glad. Thank you, sir. With all the respect towards the third gender we have in our society, from so which I'm sure you know what I'm talking about. Will there be any different urinary tract system for them, or when they change their genders, either from a male to female or from a female to a male, they obviously will wear the urinary tract which is of that gender which they have chosen to get into transplanted.
Yeah, if like male gender transforms to a female gender, then the urinary tract is made in the similar way which a normal female has.
Female we have. Okay,
Yeah.
okay. Glad. And vice versa from female to the male as
Yes.
well, right?
Yes.
Okay, okay. Glad. Thanks, doctor. And we have been hearing about this adrenal glands, right? So what is the significance of these adrenal glands? Why are they there in our body?
So adrenal glands are basically glands which are present at the top of the kidneys, and that is why they are called adrenal, because renal is the word which is used for kidney. So it's a
Oh,
gland which is adjacent to the kidney, so it is adrenal.
okay,
Okay.
okay.
Basically,
Is
the
that
main
why
function
we
of it is.
call? Sorry, sir. Is that why we have kidney function test or renal function test? Both are the same, right?
Yes, kidney function and
Okay.
renal function tests are the same. Renal is a word which is used medically for kidneys.
Okay, okay. Thanks, sir. Please continue.
Yeah. So adrenal is basically a gland which is important in the production of hormones inside the body. So there are
Mhm.
three types of hormones which are produced by the adrenal gland. One is the glucocorticoids, the mineralocorticoids, and the sex steroids. So these are the three basic hormones. The steroid, like the cortisols, are produced by the adrenal glands. Then aldosterone is a hormone which is produced by the adrenal gland. And then we have the testosterone, and these are also produced partly by the adrenal gland, apart from the
Okay.
testes.
Okay, okay, got it, sir. Now, when we talk about this urinary tract, the fundamental question what every human being has is how much urine should everyone pass in a day? Of course, there are a lot of relatable questions to it, which you will ask what is the intake of water and how long are you there in the air condition? Because as everyone know, if you remain in air condition for a long time, you tend to go to urination a long time. But ideally, what is the amount of urination every individual should do in a day?
See, to maintain a like healthy hydration level in the body, you should drink at least around 2 to 2.5 liters of water a day and produce urine to at least 1.5 to 2 liters of urine a day,
Okay. Okay. So that is an ideal one. Both for men and women, it is the same, right?
which is basically actually dependent on your body weight. So it is like 1 ml per kilogram per hour.
Will there be
Yes.
any difference in terms of because I see that women can hold the urination for a little longer time because I have my parents when we travel for a longer distances, we men can actually can go anywhere. But is that because women do not have those facilities, they're unable to go, or naturally they can hold urine longer than men?
No, it's not like that. There is no difference in the holding capacity between a male and a female.
And we also have another concern, like the frothing we see in the urine. There is a concern that people have in terms of seeing the blood also in the urine. Why, when you answer that question, could you also explain us what are the color differences one needs to observe in the urine? What is the significance of each colors, doctor?
So basically, the normal urine color is straw colored urine, which is a light yellow type of a urine. So urine can be white or clear. If we take an excess amount of water, the urine is absolutely transparent or clear. Then the normal color is straw color or light yellow. Then we can have a dark color, dark yellow color urine, which is due to underhydration or drinking less water. Then we can have blood in urine, which gives a color of reddish tinge to the urine. Then we can have a orange color urine, which may be due to the medicines. There are some medicines which are used in tuberculosis, which can cause orange discoloration of the urine. Then we can have a cola colored urine, which are due to some problems with the kidneys, glomerulus part of the thing, which are called the glomerulopathies. These are basically the different kinds of colors.
Okay. So when they see a blood in the urine, what does that signify, doctor?
Blood in urine is a very important symptom which should not be left unnoticed, which should be taken very seriously because it can be due to multiple causes. The most common cause of blood in urine are infection of the urinary tract. And second is stones in the urinary tract, which may be in the kidneys, in the ureter, or in the bladder. And the third, which most common cause, especially in old age, is the malignancy or the cancers of the urinary tract. The
Okay.
cancers may be of the kidney, it may be of the ureter, and it may be of the bladder, and it may also be of the prostate in males, especially.
Okay, okay, okay. Got
Though
it,
it
got it.
is a very important symptom and it should be thoroughly investigated.
Now, when we talk about this, this urine as a water that gets excreted out of a body through the private parts, what are the organs that are involved in that, and how do they function, which converts the blood into urine, sir?
So the main filtration organ is the kidney. So about 20 to 25% of the blood at any time or point in the body goes inside the kidney, which acts as a main filtration organ. And from the kidneys, the excretory products are excreted, and it is then removed in the form of the urine. From the kidneys, the urine drain into the ureter, which are the pipes which carry the urine from the kidneys into the bladder, and then from the bladder we have the way out through the urethra, which is different in males and females, as I told.
Okay, okay, got it, sir. And as I was asking you a little earlier, holding the urine. So, will some of them say do not hold the urine for a longer time because that causes kidney stone? This is a common, I think, statement that keeps running in the society. Is that really true? If you hold urine for a longer time, will that really cause stones in the kidney?
So this is not a true statement. Holding the urine does not predispose you to kidney stones, but holding the urine can cause other problems. For example, if you hold a lot of urine in the bladder, then that can predispose you to urinary tract infections.
Oh,
And if
okay.
you overhold the urine in the bladder, then like peeing after that can be a little problematic for some patients.
Okay, okay. How about pain during the urination, doctor? So why do some people feel pain when they urinate? Or how do I put this across? Along with the pain, we are also talking about some irritation during the urination. So why do they feel that?
So mainly pain or irritation during urination is a symptom basically most likely of a urinary tract infection.
Okay.
And the second common cause of pain during urination can be a stone which has got stuck in the ureter. Then
Okay.
they can sometimes present as pain in urination.
Okay, okay. Doctor, when we talk about these stones, so I've heard one of my friends was saying that, I had stones in my kidneys, but the doctor said it is okay. They'll get passed through the urine after a certain stage. And it did really, happen to that person. And I had few other friends where the doctor said, no, you have to go to a surgery. My first question to you is, how are these kidney stones formed? Why is the treatment protocol different to different people?
So basically, the treatment for kidney stones depends upon the location of the stone and the size of the stone. So
Okay.
for the kidneys, first say we have kidneys and then we have tubings of the kidney, which are
Mhm.
called the ureter, which open into the bladder. So the treatment
Okay.
of stone depends whether the stones are in the kidney or stone has got stuck in that tubing. Okay.
Okay.
So
Okay.
if the stone is in the kidney and it is lying in one corner of the kidney and it is not causing any obstruction and the size is less than 6 to 7 mm, then we
Okay.
can continue with the conservative management for the stones, and we can hope that the stone sometimes goes into the ureter and passes out on its own. But there is no
Okay.
medicine which can dissolve a stone. The
Oh,
stone
okay.
either will the stone either will increase in size in the kidneys, lying there in the kidneys, or it might drop down into the ureter and it may out on its own. But that
Okay.
depends on the size of the stone. Sometimes the size is big and the stone gets stuck in the ureter, and then we have to remove it surgically. Sometimes the stone becomes bigger in the kidney itself, more than 7 mm. Then also we advise the patient to get the stone removed because it's not gonna go, because the ureter is a very the diameter of the ureter is only about 4 to 5 mm.
Oh, okay, okay.
So
Because the kidney stone
usually
is larger, it cannot go through that diameter. Got it, sir.
usually
Got it.
it does not go.
Okay,
Like the
okay,
stones of 8 mm, 9 mm, they usually get stuck in the ureter, and then we have to remove it surgically.
okay,
And sometimes even we have seen smaller stones like 3 and 4 mm also. Sometimes the ureter is very tight
okay,
and the stone gets stuck in the ureter, and we have to remove small stones also. So it all
okay,
depends upon the size of the stone, the location of the stone, how much harm that stone is causing to the kidney, and then only we have to make a tailor made approach to treating the stones. There is no generalized like key. It
treatment.
depends on
Okay,
person to person.
okay. Why are these stones formed in the first place? How are these formed?
So there is a process of crystallization which happens in the kidney when the patient takes less amount of water and the urine output is less, and that crystals start depositing in the calyces of the kidneys. And as the time goes on, so it's not a very it's a lengthy process. It takes months to years to form a stone, and
Okay,
those
okay,
crystals get depositing on the same place over in time again, and then it forms a stone, which is the size of the stone usually varies from 4 mm. It can go till 5 centimeter, 8 centimeter also inside the kidney.
okay, okay. Now, when you mentioned that, this process takes a little while, months
Yes.
together. Now, can't a patient identify if the process has begun in his body or in his kidneys?
See, kidney stones sometimes are totally asymptomatic and the patient does not have any symptoms unless
Oh,
the stone starts obstructing inside the kidney, or stones are obstructing the ureter, or they cause some symptoms. So sometimes they're totally
okay.
asymptomatic and the patient doesn't know that he has a kidney stone.
How common or different are these urinary tract infections? And are they different between male and female?
The urinary tract infection is a very common problem nowadays. And there are basically of two types. One is a simple urinary tract infection, one is a complicated urinary tract infection. Simple urinary tract infections are which have minimal symptoms, and they usually affect the lower urinary tract, which is the bladder and the prostate and the urethra. And then sometimes the urinary tract infection becomes complicated, and it can also involve the upper tracts like the kidneys, and the symptoms are also vary from simple to complicated. And females per se are more prone to urinary tract infection as compared to males because they have a short urethra. Urethra also is in close proximity to their vaginal orifice or to the anal orifice, and that is why also they are more predisposed to UTI as compared to males who have a long urethra and the orifice are very far away from the anus.
What is the treatment protocol for someone who's got this UTI when they have been identified or diagnosed with UTI, doctor?
So basically, the basic treatment for urinary tract infection starts. First of all, we have to investigate in the form of a urine routine and a urine culture sensitivity test. And then the basic treatment for any infection is antibiotics, and they should be started on oral antibiotics. And sometimes we need injectable antibiotics also if the UTI has become complicated, or the bacteria which is causing the UTI is not susceptible to oral drugs. Sometimes we have to switch to IV drugs also. So it's
Okay,
basically
okay.
antibiotics.
Got it, sir. Got it. Now, when we talk about this kidney stones, doctor, during the summer times, I've read it somewhere that the chances for the stones to form in the kidney is very high. What are the precautions that everyone needs to take during this time to avoid kidney stones? Is that only
Basically,
water intake or anything else?
yes. Basically, the basic mechanism of stone formation is due to when we take less amount of water, we form less amount of urine, and this is the main cause of stone formation. And then there are some other metabolic causes also. Some patients are predisposed to stone formation because of their metabolism, even if they take normal amount or excess amount of waters. In like summer months, the stone formation is more common because we sweat a lot, we lose water, and that is why that decreases our urine output. And when the urine
Right.
output is less and we do not take enough amount of water, that predisposes us to kidney stones.
Okay, okay, got it, sir. The next question may be a little objectionable to a certain set of audience, so viewers' discretion is advised. So, doctor, this topic is about erectile dysfunction. So, what is the primary cause of erectile dysfunction, and what is the first line treatment that you offer?
The erectile dysfunction is basically of two types. One is an organic erectile dysfunction, in which a patient can have some problem in the artery or the blood supply of the penis or the veins of the penis or the nerve supply of the penis. Or it may be due to some hormonal issues like testosterone problems or some hormonal imbalances which can predispose to erectile dysfunction. The second most common type of erectile dysfunction is a psychogenic erectile dysfunction. And the patient does not have any problem with the anatomy or the arteries or the nerve supply, but it may be due to the stress, it may be due to the anxiety, it may be
Okay.
due to the performance pressure. Some patients can have a performance pressure that they may not able to perform in front of their partners, and then that plays on their mind and predisposes them to erectile dysfunction.
Okay. But what will be your first line treatments? Let's say we are talking about organic, because the
First of
second
all,
one.
we have to differentiate whether the patient has an organic cause of erectile dysfunction or it's a psychogenic cause of erectile dysfunction. And if it's an organic cause, then we will have to do the basic investigations in the form of hormone analysis, basic blood test, even diabetes. Patients are predisposed to erectile dysfunction because of the problem with the nerves and the arteries. So we have to get all those investigated. And then treatment basically ranges from medical management and last for a few patients, sometimes surgical management also. Medical management is in the form of oral pills, which we give. And then we have to correct the abnormalities. Like if a patient has uncontrolled diabetes, we have to correct that. If the patient has hormonal imbalance, we have to correct that. And for psychogenic, the basic is a counseling. We need to counsel the patient that there's no problem with your anatomy or the arteries or the nerves. You just have to relax and be stress free, and then the things get sorted.
Based on the same line, so I read it somewhere that there are certain set of audience, there are certain set of public, especially men I'm talking about, they have a problem in tight foreskin on their penis. Why does it happen? And is there a cure for it?
So tight foreskin is basically a condition called as phimosis. So again, phimosis can be from birth. It can be a congenital thing. The formation or the make of the skin is like that from birth, that it is tight and you are not able to retract back the skin. And secondly, sometimes it can happen later in life also, and it may be related to uncontrolled diabetes. The condition is called as melanogastritis. So
Okay.
treatment for phimosis is basically surgical. If patient has a phimosis, then it's a very simple surgery which is called as circumcision, which can be done as an out like daycare procedure. It's a small surgery, and there is no medicines to treat phimosis. It has to be surgically corrected.
Okay, okay. So will there be any side effects if they, they get
No,
circumcision or?
no, no. It's a very basic surgery, and the side effects will be as similar to any other surgery. Like very few, like 0.1% patients can have some bleeding, some infection, which are the normal part of any surgery, but doesn't
Okay,
have any
okay.
other side effect.
Okay, doctor. Doctor, just like any other company or any other healthcare providers, we also offer certain health packages to our customers. We are talking about a scenario where people are proactively looking out to check themselves to see if they have any conditions that they should be worried about or alarmed about. So we are talking about preventive care. Like there is a certain package that we have for men, and there is a certain package that we have for women. So that includes various the levels of tests. We are talking about complete blood picture, complete urine examination, renal function test, thyroid function test, etc.
Okay.
There is one test that differentiates between a man and woman. That name of the test is PSA. Why is that it is only specific to men? What is the significance of it?
So basically, PSA, the full form of PSA is prostate specific antigen. So as
Okay.
the name suggests, it is related to prostate. So it has to be
Okay.
done in only males.
Okay.
And
Okay.
it is basically nothing but it's a blood test which is a tumor marker for prostate cancer.
Oh.
So we do it in males starting from the age of 50. So we advise
Oh,
all the males above the age of 50 to get this test annually till the age of at least 75. This is
okay,
just to detect cancer prostate in the early stages.
okay.
So it has to be done only in the males because it is related to prostate.
Okay. So let's assume there has been a condition that has resulted in a cancer related to prostate. So what is the course of action medication? Is that very similar to other cancers, or removal of the prostate gland is going to be a cure for it?
The treatment of prostate cancer depends upon the stage at which it is detected. So the treatment options can vary from surgery to radiation therapy to chemotherapy or to something which is called as a hormonal therapy for cancer prostate. So
Okay.
it is just tailor made according to the stage of the disease at which it is detected, and the treatment depends upon the stage.
Right, right. Thank you, doctor. There is this question from one of the public again. So when we talk about male infertility, when is that they need to look for a specialist?
So if a couple is trying for having a baby, when we are trying for a child with unprotected intercourse for more than 12 months, then usually we ask the patients to seek medical advice. And if there is no female factor which is responsible for the infertility, then the male also should be investigated for any like any reproductive issues, any decrease in the sperm count or the decrease in the sperm motility, which may be responsible for the infertility issues they are like dealing with.
Okay, okay, thanks. Doctor, there is another misconception before we end this urinary tract related questions and move on to the next category. There is a common myth when you go to public toilets, either men or women. Of course, hygiene is also important, but there is another angle to it that you may catch urinary tract infections in the public toilets more compared to your private toilets because you maintain them clean. Is that really true?
It's actually a misconception actually. So even if the like toilet is dirty, the germs cannot travel through the air into your urinary tract.
Oh,
It is
okay.
basically the sometimes it can be related to the hygiene. Sometimes it may be related to the sexual hygiene which we maintain,
Okay, okay. But
and
it's not related to those commodes
not
or to
related to
those
using the public toilets.
great. I mean, that this is a very big myth. Then you have really busted. Doctor, you were talking about a prostate cancer surgery, right? So once,
Yeah.
let's assume a person gets a prostate cancer and he underwent a surgery and the gland has been removed. Can that person continue his sexual life, or will that affect his sexual life?
See, prostate cancer surgery or the removal of prostate is called as radical prostatectomy. And one of the main side effects of this procedure is erectile dysfunction. So,
Oh,
like 30 to 50% chances that that patient may have erectile dysfunction and he
okay,
may need some assistance in that. So,
okay,
sometimes that erectile dysfunction gets treated with medicines and sometimes it does not.
okay, okay. Right. I
So,
mean,
it is
this.
one of the common side effects you can say of the
Okay.
prostate removal surgery.
Okay, okay. Doctor, now when we talk about these urinary tract infections in women, why is that in post-pregnancy, women are more prone for this urinary tract infections? I've read it in one of the articles. Is that really true?
It's actually not post pregnancy, it is actually during pregnancy also that UTIs are more common.
Okay.
And that is because we have a large uterus, and sometimes the uterus can compress one of the ureters and cause some swelling of the kidney, which causes the stasis of urine in the kidney, and that can predispose. And sometimes the uterus can also push on the bladder and can make it difficult for the woman to pass urine, and that can also predispose to urinary tract infection.
Okay.
So it is
Okay.
basically not post pregnancy, but usually during the time of the pregnancy that patients can have multiple episodes of UTIs.
Okay. But I mean, will they also be treated with the similar kind of a medication? Because
Yeah,
what
yeah, which is
what we
safe
usually
for the which are safe for the fetus. So there are some
yes.
medicines which cannot be given, but there are a lot of medicines which can be given during pregnancy also.
Great, great. Doctor, there is this term that came to our notice when we were discussing about this female urinary tracts as well as female reproductions. There is something called as a prolapse. I think it is called as a pelvic organ prolapse. What is this? What are the types of then?
See, prolapse is basically when the pelvic floor muscles weakness is there, then the pelvic organs can prolapse, especially in the old age female or the patient, the females who have like multiple childbirths in the past. They can have that prolapse of the bladder, prolapse of the uterus, and this is basically related to gynecology also. There can be
Oh,
prolapse of the uterus. So
okay,
these are
okay. We are talking about this contraceptions, as one of the topics when we talk about it. So, how does this contraceptions affect the bladder health for the females?
See, if you are practicing a good sexual hygiene and using a protected mode of intercourse is always better and in preventing the urinary tract infections for the females. So if you are using a protective type of intercourse or you are using a protected barrier, so that also helps in decreasing the incidence of urinary tract infection in the females.
Okay, okay. No, doctor, there is this myth. Feminine hygiene affects the urinary tract infections. So, how true it is? Is that, a myth or is it really true?
Yeah, as I told you, the all the orifice, whether it is of the urinary passage or the vaginal or the anal orifice, all these orifices in the females are very close to each other.
Okay,
So if we maintain a good sexual hygiene and good personal hygiene, obviously the risk of UTIs will be less because
okay,
urethra is very short. So if any contamination is there on this outside the skin also, that can travel inside the urinary tract.
okay,
So
okay. So, that's why the
that
hygiene is
obviously,
very important for them. Got
yes,
it, sir.
obviously
Got
for
it, got
their
it.
thoughts.
Right, right. It's the same for the males as well. So,
But
now
for
when we
females,
talk,
it is more common.
right, right. Now, when we talk about this cancer, so what are some common urinary cancers that we can see in India?
So most common cancer in the urinary tract is of the prostate. Then apart from that, we can have kidney cancer, we can have bladder cancer, which are very, very common. We can have cancers in the ureter also. We can have cancers of the testicles also in males.
Okay, okay. Right, right. Doctor, now when we talk about these kidneys, either it can be related to a cancer or it can be a kidney dysfunction. As being a kidney transplant expert, keeping all the legalities aside, because everyone is aware of what are the legalities, either you should be having a blood relation or you should take a pre-approval from the authorities for you to get a kidney transplantation for various reasons. Let's keep that legality or administration part aside. From the medical standpoint, doctor, how long does it take for a surgery which is kidney transplantation in an ideal condition?
Oh, the duration of the surgery.
The duration of the surgery, yes.
Yeah, basically for the donor, the duration of the surgery is around 2 to 2.5 hours. And for the recipient, the duration of the surgery is around 3.5 to 4 hours.
Okay. So will there be a same team that will do on the both? I meant to ask parallelly or one after the other?
Yes. So it starts parallelly. And first we start with the donor, and then the recipient also, we start making the incision and we start preparing the bed for the kidney to be kept, and then we remove the kidney from the donor, and then we bring the kidney from the donor side to the recipient side and start the fixing the kidney in the recipient's body.
Right, right. Doctor, whatever comes naturally to us is something which matches 100% because that is God given. Whatever we do artificial, there cannot be a guarantee of 100% that it would be accepted by our body, right? So the
Yeah.
same happens in the kidney transplantation as well.
Yes.
However, we perform a lot of tests to assume that the body accepts the foreign body, which is of a similar nature for the functioning. In your experience, was there any case where you were sure shot in terms of kidney transplantation becoming success, but it has failed and which disappointed you along with your team? Can you share any case study like that? Did it happen in your scenario?
So kidney transplant has its own risk, and there is always a risk of rejection. Sometimes we do not expect that rejection in a patient, and rejection can happen. And that has also happened in one case in which it was a hyper acute type of a rejection. So as soon
Okay.
as we started fixing the kidney in the body rejected it, and the kidney turned black. But
Oh.
that is a very rare scenario, but can happen. And we explain the patients before the surgery about all the possible risks, complications, risk of rejection, and everything. But that has to be taken with a pinch of salt. that
Right.
rejections can happen at any time and with any patient,
Okay.
despite
So,
taking all the precautions preoperatively.
true. What are some precautions the patients should take after they have been transplanted with a new kidney in their body, doctor?
Basically, see, kidney transplantation, we put the patients on immunosuppressants. The immunity of the patient is low. So, since the immunity is low, we have to maintain good, like we don't need to catch any infection. So, we tell the patient to maintain good hygiene, good food hygiene, and whatever he's eating, and always like wear a mask when you are traveling out of the house. And we tell their relatives to uh, in the initial stages to meet them only after wearing a mask or like that.
Okay, okay. Doctor, the pollution and the contamination around us is growing every day. We talk about air pollution till the food pollution, especially in a city like Delhi, being the capital, the air pollution is also very high there. So, how are these patients managing themselves after the kidney transplantation is done? Was that not difficult for them?
Yeah, obviously it is difficult for everybody, especially for them after the transplant. They are predisposed to respiratory infections, especially in such an air quality index, which is very poor or hazardous. So basically, just I told before, mask is an important barrier which can protect these patients from the harmful fumes or the harmful respiratory infections. And secondly, we tell them to be stay indoors for the initial period and not to travel outdoors. And they'll probably maybe use an air purifier if they can.
Right, doctor. Doctor, we talk about a urology as a profession. I'm sure a lot of metros, tier one and tier two cities have urologists. However, there are certain people who also would like to speak with a top urologist or someone who's more experienced when it comes to this urinary tracts or reproductive health or erectile dysfunction, etc. What are some cases or some symptoms that they can, from any corner of India, can consult you and also take first line of suggestions or medication, doctor? Of course, something like a transplantation, obviously, you need to see the doctor in person. However, if they wish to consult you online, what are some cases? What are some symptoms that they can identify which they can consult with you online?
Basically, the main symptoms which we deal with as a urologist are related to kidney stones. So, if the patient has some pain in the flank or some blood in urine or some burning sensation during urination, pain during urination, some patient have a problem of erectile dysfunction. Patients have problem of decrease in the urine output, or they have some swelling in the feet which may be related to the kidneys issue. So these are the basic signs and symptoms which we deal with, and patients can consult that for the same online also.
Great. So, ladies and gentlemen, so you have heard it directly from the doctor. So, these are some symptoms that you can watch out for, and these are some conditions that maybe you have got it diagnosed in your native places in your locations. However, Dr. Anuj is available on our platform, Medicas. He's available both on our mobile application as well as on our website. The link is going to be displayed in the description, as well as you can see it in the scroller that you see at the bottom. You can consult with him, either get a first hand opinion with the symptoms that you're already having, or if you already have some reports in your hand and if you wanted to reconfirm, you can also get a second opinion from him. He's a qualified, not only in terms of academics but also in terms of an experience. He's got well over 10, 11, 15 years of experience in this area. So he's not only a urologist but also an onco-urologist, which is he also deals with urinary tract or reproductive cancers. Not everything related reproductive, but he also shares the similar kind of an action with gynecologists as well. So once again, thank you so much, ladies and gentlemen, for your time, Dr. Anuj. I know you have been a very busy doctor, but yet you have taken some time out to discuss these important things with our audience as well. In another podcast, we'll come up with more specific questions which is directly collected and which are more common to be discussed. Until then, thank you so much for your time, sir. Namaste.
Thank you so much.